The growing trend of NHS hospitals who are involved in charging for private treatment is indicative of the increasing financial pressures on the UK's public healthcare system. And despite the founding principle that the NHS should be free at the point of use, many trusts are exploring private income streams to address significant budget deficits. This approach, however, raises critical concerns about the future sustainability and accessibility of healthcare in the UK. NHS trusts are projected to generate a record 770 million from private patients in the last financial year who are accessing the machinery available in NHS hospitals. It's a substantial increase from previous years. This trend is expected to continue, potentially reaching 1 billion by 2025 to 2026. And the primary driver behind this shift is the financial shortfall faced by many NHS trusts, compounded by a deficit forecast of around 2.2 billion for the 2024 to 2025 period. In response, trusts are capitalising on private patient income, especially as long waiting lists and delays have made many patients consider private options despite the associated costs. And what this often means is a private wing of an NHS hospital, which provides private rooms and some element of focused and regulated care, which can be accessed at a time that's convenient to the patient, or indeed gives the patient the opportunity of getting treatment in a timely manner. But effectively, it's NHS care with a television and a daily newspaper. The Labour Party, as traditionally associated with supporting the NHS's public funding model, has indicated a more pragmatic approach under the current leadership, and the Health Secretary has suggested going further than previous administrations in leveraging private sector capacity to alleviate NHS pressures. And this strategy echoes the initiatives from the Blair era, such as the introduction of the patient choice and contracting private providers for specific surgeries. I think we have to go beyond that. The increasing reliance on private income by NHS trusts could lead to a more entrenched two-tier health system. And while NHS hospitals can use private patient income to reinvest in public services, this shift also risks prioritising those who can afford to pay. For example, Buckinghamshire healthcare NHS trusts offer private rooms with luxury amenities, highlights how hospitals are seeking additional revenue streams. Yet this could be perceived as commoditising healthcare, potentially undermining the principle of equal access for all. What we actually need is a clear two-tier system. We need a clear difference between the systems. We need a private system, and we need an NHS system. What we've got at the moment is a fusion of the two. So most private care which is on offer only kicks in once somebody has accessed an NHS GP recommendation. The system is extraordinarily complex, and I think in the end abusive. Not only because NHS surgeons and nurses are effectively moonlighting in the private system. We need a wholly private system, and we need a wholly state system. And I think it's acceptable for the state system to pick up the emergencies and to do the surgery that the private system cannot do. But this idea of this private wing of the NHS is faintly worrying. The fact that it's making some money for the NHS, I think probably is good. But the problem is the NHS is not private and hasn't been private, is not public and hasn't been public for a long time. It's involved in deals with private companies simply to access medicine and equipment. All of that is privately provided. And the idea that one trust will compete against another trust and it is nonsensical. This whole idea of trusts is nonsensical. It needs to go. We need to be back to the idea that there is a monolithic NHS that works effectively, which means a bureaucracy which is intact and which is efficient, and getting rid of all these little squires of independent hospital trusts, because you can't trust them. The public sentiment appears to be shifting, with 67% of people considering private healthcare because of the long NHS waiting list. But it's not only because of the long NHS waiting lists. That's what the media wants you to believe. It's also because the NHS system is unreliable. And people think that by going through the private system, they're going to get more control of what happens to them. The problem is that isn't true. Because accessing your notes, your medical records in Britain, is nonsensical. Because you can't be sure that your notes are authentic. That when you ask for information, you can't be sure that what you're getting is actually the information that relates entirely to you. It's all been filtered through so many levels of bureaucracy. The private sector is capitalizing on the chaos of the NHS. With record numbers of hospital admissions for private patients, and this change in public attitude reflects a growing acceptance of private healthcare as a necessity rather than a choice, which will fundamentally alter the landscape of healthcare provision in the UK. I think in some ways that's not necessarily a bad thing. If you can pay and take the strain off the NHS. But if you can pay, then I think there's an argument for saying it should be an independent, genuinely private system that you're paying for, rather than this two-tier NHS. The ethical implications of this shift are significant. On the one hand, utilising private sector resources can help reduce NHS waiting times and provide care for those in urgent need. On the other hand, it raises concerns about the NHS's role as a universal healthcare provider. If private income becomes a crucial part of trust finances, as it has done, there is a risk that NHS core values will be compromised. But the point is, I think we've crossed that Rubicon. NHS core values are already compromised. And that private income is already supporting and in some ways paying for the NHS. What we need to do is to leverage that process. And how that happens, I don't know. The idea that the NHS sends its patients to private clinics, or rather to the private wing of NHS hospitals to be treated more swiftly, is nonsensical. It's nonsensical, given the fact that the equipment is pretty well the same. What we need is to ensure that the waiting lists are cut down. And that means cutting out the unnecessary expenditure. That means cutting back on the bureaucracy and making sure the bureaucracy which is left is rational. That means one bureaucracy, one system to rule them all, one ring to guide them all. And the multiplicity of bureaucracies is what is bringing the NHS down, with the multiplicity of bureaucrats to manage those bureaucracies. And of course, they are extraordinarily resistant to change because they want to keep their jobs, because they're sitting pretty, doing very little and raking in the cash. And at the same time, the people who are really working hard, the junior doctors, the nurses, the surgeons, the consultants, are working their backsides off. And there are reports in the last few days, Lord Darcy's report doesn't help. That the professional staff, the nurses, the doctors, the surgeons, are doing less work now than they used to do. I don't think that's true. But I do think that the GPs are doing significantly less. And the problem is, in the way the report is structured, there's a confusion over who is being talked about. I've spent a lot of time in the last few years in the middle of the system. I've also spent a lot of time listening to whistleblowers. And I think that gives me skin in the game, so to speak. And I'm horrified by what I see and what I hear. The increased integration of private healthcare within the NHS framework reflects a broader challenge and a response to financial pressures. And while this trend offers a temporary solution to alleviate immediate pressures where the NHS can access money raised by using its private wings, and while there's a possibility of transferring patients into those private wings, this risks deepening inequalities and compromising the foundational principles of the NHS. A balanced and carefully considered approach is needed to ensure that the NHS remains true to its mission of providing high-quality healthcare free at the point of use for everyone, while pragmatically addressing the growing financial and operational challenges that it faces. That means we possibly have to rethink what our private healthcare system is grounded on. And we ought to look to other healthcare systems in Italy, in France, in Turkey, where the private system can be accessed and paid for, and the state system can be accessed and paid for, and the two things can work together, but they are thoroughly independent of each other. What we've got at the moment is a private system which is dependent on the state system. So the private system should be there to help the state system, but to be dependent on it, I think that's where the fundamental problem exists.